So you finished the first two cases, and now you're into case number 3 on high blood pressure. CJ is now 45 years old. She's divorced. Her kids are 12 and 14, and this phase of her life introduces a whole different set of complexities that are especially on many levels, but related to leading a healthy lifestyle for sure. So again, the questions, the case questions on this case are consistent with the others. The one piece on this is that now what you are going to start to do is fill out the last question of the cases, the case questions, asks you to complete the physical activity program that's on the following page. And this then is where you start looking at information specific about CJ, at least for what you know so far. Okay, you have to ask a bunch of questions to find out more answers. Of course, to do a physical activity program that's complete, but complete the documentation on the physical activity program as best you can with the information that you know. This will get you a little practice to start doing this portion of the documentation system, and that's the point of this. So try to be as specific as you can for short-term goals. And then again, it can be a little more general for long-term goals, but certainly short-term goals within the first 4 weeks. Try to be as specific as you can for those, such as start off week 1 exercising 2 times per week for X amount of time doing this activity, that type of thing. Long-term goals could be consistency, this is just an example, consistency of with your exercise program, 90% consistency or 80%, or hits most of the days of the week, however you want to word that. It can be not as specific, but certainly to have something in mind for long-term, that we're not just talking about short-term but long-term. And then as far as the physical activity prescription goes, what particular activity, what is the frequency or the number of times per week, how long are they going to do it, which is duration, intensity, which is likely to be worded as light, moderate, or high. And then progression means this is their starting point here. Are we going to stay there? Are we going to go in a direction, increasing duration, or increasing frequency, or increasing intensity, that type of thing. And then one of the things that I put on here for the last one is always to keep in mind is, when do you want to reassess or follow up with them? So some folks are going to need weekly follow-up, especially at the beginning. Some people are, as you get rolling, then aren't going to need follow-up, but monthly. And then as you really get down the road, some people 3 months, 6 months, that type of thing. So the way we do it for the risk reduction program is we follow up with them for most people on a weekly basis for the first couple weeks. Some people even sooner, just via phone call or email. And then as they go through, it's a monthly. So everyone has to meet with us on a monthly basis to keep tabs. And then, once they're really self-sufficient, then we can spread that out every 3 months, twice a year. For some people, it's even once a year. The people who've been in the program for 5-6 years now, it's really just kind of a once a year touch and base, as far as seeing each other face to face, but otherwise it's an email contact to make sure everything's okay. So keeping that in mind, what's your follow-up? And that all depends on the individual and what they need for follow-up. So that's your case 3, or the one that's on hypertension or high blood pressure. So this finishes out the cases that are due for Module 7. So submit those in, analyze one of your partners, or analyze, that's too clinical, right? Give some feedback to them, some constructive feedback on how they did, so we can all improve our case study write-up. And really it's just about opinions. One of the things that I didn't mention early on is that this is definitely an art. Doing a case study is an art. Filling out one of these programs for an individual. There's no exact right answer every time, and so sometimes people can have differing opinions about how we should start and how we should progress and what activities we should use, that type of thing. So that's why these are good to, we can comment on each other, and each of us has our own style of doing this, and keep that in mind as you're filling it out for yourself and as you're looking at your partners. All right, let me know if you have any questions. Good luck on this assignment. Thanks.